Assembly of the SADC Parliamentary Forum during its 46th plenary in December, wherein young people were placing before leaders, in particular parliaments, for certain commitments that our member states have made relating to SRHR issues that relate to young people. As I said, this is a second in a series. The first series, we had the speakers of Seychelles and Zimbabwe. In this regard, allow me on behalf of the Secretary General and indeed on behalf of the partners and the organizing team to thank most heartily the Speaker of the Parliament of Malawi, Madam Catherine Gotani Hara, for sparing time to engage with young people through this platform. In the same vein, I wish to extend our sincere thanks to the Speaker of the National Assembly of Eswatini, Honorable Petros Mavimpela, who is represented in the meeting by Honorable Stridom Mpanza, for sparing time to engage with young people. Without any further ado, I would like to then advise the meeting that the moderator for this meeting is going to be Madame Primrose. And I would now invite Madame Primrose to take over the program and invite the next speaker as we commence our meeting. Thank you very much.
Thank you, Tshwane Kurasha, for the kind words and the welcome remarks. Without further ado, our next speaker will be Dr. Justin Coulson, the acting UNFPA Regional Director, who will be giving remarks on behalf of all UN agencies. Dr. Justin leads UNFPA's regional program, which addresses universal access to sexual and reproductive health rights, youth empowerment and well-being, gender-based violence and harmful practices, as well as data and innovation. She has over 25 years of experience in international development sector, and for the last 15 years has specialized in the field of sexual and reproductive health rights, working in Africa, in Asia, and Latin America. Prior to joining UNFPA, she was the regional director for South Asia for Marie Stopes International. She also held country leadership positions with MSI in Nepal, Tanzania, and Uganda, and worked as an advisor in the Poverty Research and Policy Center at Save the Children in the UK. She began a professional life as the Gender and Social Development Advisor at the Global Urban Research Unit at the university, where she conducted international research on a wide range of topics related to urban development. One is tempted to ask what she has not done. I give you the podium, Dr. Justin. The floor is yours.
Thank you very much, Primrose, and thank you, Tshwane, as well, our other co-moderator. Unfortunately, you will find that as you get older, your bio tends to get a lot longer, but thank you for that very warm welcome. So our Right Honourable Catherine Gotani Harris, Speaker of Parliament of Malawi, Right Honourable Petros Mavimbela, Speaker of the House of the Assembly of the Kingdom of Eswatini, Honourable Members of Parliament, Ms. Boemo Sekgoma, Secretary General of the SADC Parliamentary Forum, young leaders, fellow UN colleagues, and all of our participants online, a very, very warm welcome and a warm good morning to this online debate and discussion. On behalf of the convening UN agencies, I'm delighted to welcome all of you to today's online engagement with speakers in the national parliaments and young leaders, which has been organised in partnership with the SADC Parliamentary Forum, UNFPA, UNAIDS, UNESCO, AFRIAN, Restless Development, and the African Population and Health Research Centre, APHRC. Please allow me to start by thanking our honourable speakers of Parliament of the National Assemblies of Malawi and Eswatini for really making their time to participate in today's exchange, This is really tangible proof of your commitment and leadership on issues related to young people in your respective regions and in SADC as a whole. It's also a real pleasure to have so many young leaders from across the region participating in today's dialogue. We're grateful to have you with us and to be able to benefit from your valuable contribution during today's proceedings. And we really hope this will be an opportunity to exchange ideas for change and to foster meaningful collaboration amongst parliamentarians and young leaders. Today's webinar is the second online engagement as part of a series of webinars planned to ensure that young people from the SADC region have the opportunity to engage directly with their parliamentarians. And we're here today to advance the commitments set out in the Tshwane Declaration adopted at the 46th Plenary Assembly session of the SADC Parliamentary Forum in December 2019, building on the extensive and rich deliberations held during the Youth Endeavour last year. By adopting the Tshwane Declaration, SADC parliaments committed to strategic actions aimed at domesticating already signed or ratified global, continental and regional commitments on sexual and reproductive health and rights, HIV prevention, treatment and care, and gender equality, whilst also supporting inclusive, systematic and meaningful youth engagement on matters that affect young people's lives. The adopted commitment encourages enhanced partnerships that bring together parliamentarians, government, civil society, youth leaders, development partners, the private sector and the United Nations family and other key actors to jointly mobilise efforts and resources for action. In the SADC region, about 75% of the population is under the age of 35, and yet people under the age of 35 rarely hold political leadership positions. While we continue to advocate for the inclusion of young people in the political arena, this dialogue focuses on strengthening the partnership between decision makers and youth leaders through an honest and respectful intergenerational dialogue fostering youth-led accountability. The progress made on taking forward the commitments of the Tshwane Declaration into 2020 has obviously been challenged by COVID-19, which has aggravated the challenges already faced by young people in the region. Young people are telling us that they're facing limitations in accessing integrated HIV/SRH services due to a disruption of service delivery and a fear of acquiring COVID-19. They're also telling us about a rise in teenage pregnancies, increased gender-based violence against adolescent girls, loss of livelihoods and education opportunities, as well as exacerbated mental health issues. If there's anything that the COVID-19 pandemic has taught us, it's the price of inaction, which is very, very costly. Now more than ever, we need to challenge laws, policies and practices that negatively affect the sexual and reproductive health and rights of adolescents and young people, whilst also promoting learnings and the sharing of good practices amongst countries. And this dialogue today gives us that opportunity. Today, we have the unique chance to listen to key decision makers and discuss pivotal issues related to the well-being of young people. Parliamentarians play a critical role within their respective societies and communities. They have the mandate and public trust to act in the best interests of their citizens. They do so through the enactment of laws, through voting for their respective national budgets, while holding their executives accountable through their power of oversight to ensure compliance with commitments made. Harnessing the willingness of the honourable speakers of the National Assemblies of Eswatini and Malawi to open up the doors of Parliament to young leaders, I'm sure that today we will make strides towards achieving the commitments of the Tshwane Declaration, of a region that promotes and respects the sexual and reproductive health and rights of adolescents and young people. And I really wish you all an excellent session today, and I'm very much looking forward to hearing about the progressive outcomes that come from your dialogue. Thank you very much.
Thank you, Dr. Justin, for your warm words. Indeed, it takes all of us coming together to ensure that the Tshwane Declaration commitments are made. Our next speaker, I'm very excited about him because we connected in Pretoria and spent a week together, and it's really nice to see you again, Senator. He was also part of the team that actually crafted the Tshwane Declaration and has made strides with SADC-PF to ensure that it's adopted. Without further ado, I introduce you to Senator Mkhululi Dlamini from the Parliament of the Kingdom of Eswatini to give us the overview of the Tshwane Declaration.
I'm trying to connect. Can you hear me?
Yes, we can hear you clearly, Senator Dlamini. We can hear you clearly.
Okay, excellent. Thank you very much, moderator, and thank you for inviting me to be part of this important session. I think it would be unfair for the rest of the people in the meeting if I wasn't to give an overview of the meeting first, because the week that you talk about was very exciting. Many young people together talking about issues that affect them. The main issue was the sexual reproductive health rights of young people. However, we ended up speaking about everything that affects the youth. And yes, as an overview of the declaration, the young people declared that they want to be more involved in decisions. They declared that they really don't think that their voices are heard enough, nor they can hold the executive accountable. So the declaration was, we want to be more involved. We want the executive to be more accountable. We want our freedoms of expression and choices as young people to be understood and implemented in the way that we want to. There was a phrase that was used during the discussions of coming up with the declaration, that nothing about us without us. And it was a very strong statement that the young people made. There were platforms that the young people felt needed to be made available for young people in order for them to be in control of the narrative of their sexual reproductive health. The socioeconomic challenges that they were faced with, the young people felt like that was not considered when deciding on how to move forward with the issues regarding their sexual reproductive health. I think as a huge takeaway in the declaration was that everyone who was there must go back to their home countries and ensure that they create the platforms where they meet with their parliamentarians in order that something happens about it. I guess as an overview, that is what I would say to the meeting. At the end. Am I there?
Yes, thank you very much, Senator Dlamini, for that overview and the fact that you actually just really personalized, what the key issues young people want addressed are. So thank you for that. I will now move on to our next speaker, African Madagascar member called Miss Leah. Miss Leah is going to take us through the UNAIDS Global Report on HIV and AIDS. She will give a special focus on new data on challenges faced by adolescents, girls, young women in Eastern and Southern Africa. Just a little bit about who Miss Leah Fabrice is. So she is the partnership manager inside an organization called Tshwane du Monde Avenue. She's also a strategic and independent consultant in project management and winner of the Worldwide Campus Challenge 2020 edition. She believed that investing in young people is the best way to sustain development. She volunteered as a support in the Youth and Adolescent Program within the United Nations Fund for Population Madagascar for a year. Over to you, Miss Leah. So maybe before you come in, I'll just request those who are not speaking to kindly mute their mic. Please unmute your mic when you're speaking only. And if you have any issue you want to address, please type it in the chat box. Thank you. Over to you, Ms. Leah.
Thank you, Madam Chair, for the floor. Thank you so much for inviting me to be part of this session. And I want also to thank all of you for allowing me to be here. So, honorable speakers, distinguished guests, ladies and gentlemen, I'm very happy to be here, as I said. And as the chair already introduced myself, I'm Leah Razaf-Mansoun, and I'm from Afrayan, Madagascar, and leader of some organization working in youth empowerment and advocacy in sexual reproductive health and rights in Madagascar. I'm going to share with you today the UNAIDS Global Report on HIV and AIDS with a special focus on new data and challenges faced by adolescents, girls, and young women in East and Southern Africa region. The three top-line key messages of my intervention is about, first of all, the AIDS pandemic remains a global crisis, fueled by inequalities that demands that we double down, build on our successes, and act with greater urgency to reach the millions still being left behind, because there's millions still left behind, and we don't want to left behind anybody. And secondly, the COVID-19 has seriously impacted AIDS response. Even before COVID-19, we were not on track to meet the global targets for 2020. Now, the COVID-19 crisis risks blowing us away, of course, but community become resilient and innovate faced to that COVID-19 and on HIV. Third, the gender inequalities, which is denying women and girls the ability to make their own healthcare choices. Also, I want to give us some snapshot progress in our region. First of all, I want to send the warmest congratulations to the Kingdom of Eswatini, which is one of the two only countries in the world, along with Switzerland, to have reached the UNAIDS 95 treatment targets 5 years earlier. So congratulations to those who represent the Kingdom of Eswatini here in the session. And of 14 countries globally to have reached the 90 targets 6 months early, 7 are in our region. Botswana, including Botswana, Eswatini, Namibia, Rwanda, Uganda, Zimbabwe, and Zambia. And 3 are very close, including Malawi with Kenya and the United Republic of Tanzania. With 20.7 million people living with HIV in our region, 15 million are on life-saving HIV treatment, which is a very huge progress. And new HIV infections have declined by 38% from 1.2 million in 2010 to 713,000 in 2019, more than in any other region in the world. And also the AIDS-related deaths among have declined by 49%. The report also noticed that funding for HIV responses in the region increased by 25% between 2010 to 2019. The report noticed also that domestic sources accounted for 41% of total HIV funding in 2019, with South Africa responsible for most of the spending. But there's some challenges, because 26% of new infections in our region are among girls and adolescents and young women. So in sub-Saharan Africa, women and girls accounted for 59% of all new HIV infections, which is 2.4 times as likely to acquire HIV than their male peers. So this is terrible, terrifying. And in our region, in sub-Saharan Africa also, every week, 4,500 adolescents and girls and young women between the age of 15 to 24 years are becoming infected with HIV. And 3,600 are in our region. And adolescent girls and young women accounted for 26% of new HIV infections, as I said, in 2019, more than double their share on the population. And roughly 1/4 of new infections in this region are among key populations and their sexual partners. There's also challenges related to unintended pregnancy and violence on HIV. So girls married before 18 years of age are more likely to report intimate partner violence and forced sex than those married after the age of 18, because they do not have the ability to say no. And early marriage often sees young girls married to older men with whom they have less power to negotiate safe sex. The report said that between 2013 and 2019, 35% of young women in sub-Saharan Africa were married before the age of 18. So they do not have the ability to say no because of this. And knowledge about sexual reproductive health and rights, and also the prevention of HIV and STIs among adolescent girls and young women is low. Only about 1/3 of women aged between 15 to 24 years in sub-Saharan Africa have knowledge about comprehensive sexual knowledge about HIV. The access to education, the report noticed that education is strongly associated with good health, and it is an important predictor of well-being among women and their children. It's normal because when you have education, you know what you do, where you do it, with whom you do it, and I mean the sex. So despite evidence for the benefits of remaining in school, girls and young women in multiple settings around the world face significant barriers to education, driven by poverty, unequal social and cultural norms, harmful practices such as child and early and forced marriage, poor infrastructure, and gender-based violence. Patriarchal norms that devalue the education of women and girls also limit their opportunities to access and stay in education. This situation in the report also shows that communities at the center is important, because what the veterans have learned of AIDS response is that community must be at the center of the COVID-19 and HIV response. And because they are resilient, civil society and community-led organizations of people living with HIV much to offer in terms of preparedness. That is also the case of youth on their issues. This situation, the COVID-19 has showcased community resilience and innovation, because, for example, during this time, the community of people living with HIV, the networks is delivering antiretroviral medication and also helping themselves between them. So the 2020 global AIDS targets are unlikely to be reached because of the intersecting inequalities, including in the context of COVID-19 pandemic. Because the COVID-19 pandemic compounds these inequalities and heightens the vulnerability of people living with HIV. And gender inequality, human rights, financing. And if we do not put into place a truly transformative laws, policies, and programs in this region, we will continue to not meet our targets. So as a concluding remark, adolescent girls and young women are particularly vulnerable to HIV infection, and programs to reduce inequalities, harmful gender norms, and other underlying social, economic, and structural drivers are required. And momentum is growing for a comprehensive multi-sectoral approach that reaches beyond the health sector, and that is gender transformative, rights-based, and tailored to address the multiple social, economic, and structural drivers that fuel the HIV risk of adolescent girls and young women. The UNAIDS is currently advocating with us, young people, for a people's vaccine because we are aware of these inequalities. The same applies for all treatments, tests, and other technologies. What we have to remember is that AIDS is not over yet. We must apply eternal vigilance to the response. And thank you so much for your attention. If you have any questions, I'll be pleased to respond. And those are some resources from young people. Thank you so much.
Thank you very much, Miss Leah, for that great presentation. Moving on to our next speaker, you will notice that young people are just not demanding for things to happen. In this next presentation, young people are also just really going to share with us what they've been doing, the best practices in terms of the actions they have been taking, and the kind of challenges they have been facing as well. So the next speaker is going to be Mr. Tshwane Njaya, who will be sharing best practices from AFRIAN Malawi to advocate for adolescent sexual and reproductive rights. Mr. Tshwane is the president of the Malawi National Youth Network, AFRIAN Malawi chapter. He is the current president for the Malawi National Youth Network. He's trained and also a trainer of social accountability, especially focusing on political economy analysis. As a youth champion under the Voluntary Service Overseas Global in a platform called Youth Engagement, which aims at empowering the youth to champion development projects as change agents, youth advocates, as well as youth volunteers. He has worked as a government intern in the management of education information systems at district level. Over to you, Mr. Tshwane. Your microphone is on mute. Okay, we seem to be having connectivity challenges with Mr. Tshwane. So we'll just give you one final attempt, and also just note that your microphone is also on mute. Okay, perhaps we'll come back to Mr. Tshwane after this session. It appears as if maybe he's having connectivity problems because I'm not getting any feedback. I can see him on the screen, but he's not responding. I see some movement actually. It seems like we have you now. Yes,
Primo,
you're
yes,
with us. Please do take the floor. Please do take the floor.
Thank you so much, Primo. Thank you. Honorable speakers and all the participants, I'm very honored to have this floor actually to share the best practices that Malawi actually as young people we're doing. Firstly, I would like to take you through the adolescents and the youth in Malawi, especially on the data. Malawi is a nation which is youthful, with 78% of the population of those people who are the youth and the children under the age of 35. Of course, according to the Malawi National Youth Policy 2013, the youth are described as 10 and 35 in terms of the age. And it should be noted that young people from different youth-led organizations prescribed by the National Youth Policy, we came together as it has been stated, and we are in an umbrella which is called the Malawi National Youth Network, which is also African chapter, as it's been stated by Primo. And of course, we have over 28 district youth networks that are led by the youth themselves in the respective district structures. And of course, our major cities are divided into two, the rural and the urban, which is making up to 32. As Malawi National Youth Network, AFRIAN Malawi chapter, we have successfully advocated for the introduction of the youth caucus in the parliament, which we have always seen that it will really be one of the ways or one of the platforms where our issues, our problems will be actually tabled by the youth of parliamentaries, and of course, our voice is being heard. which among them, we're talking about the adolescent sexual and reproductive health and rights, of which young people also, we have been regularly engaging with the relevant institutions through the national network, of course, to influence legal and policy reforms related to sexual and reproductive health rights. And I'll be able to mention one of the policies which young people actually came in. And of course, we have seen it, the 2017-2022 SRHR policy. And of course, we are celebrating, of course, the age, the minimum marriage age, which is now 18, and it was actually signed by the former president, which is also one of the landmarks that young people as advocates we've actually done. In addition to that, youth in Malawi, we are also leading change in policy formulation. And currently we are having the review of the national health policy, of which other areas to do with the sexual, reproductive and health rights are definitely being tabled. I happen to be one of the people that have benefited this one, and issues to do with the SRHR, adolescent health and sexual reproductive health, also have actually been incorporated, and now and again young people are putting it inside it. Of course, we're talking about other areas to do with youth organizations that have advanced the adolescent and youth SRH agenda by actually engaging the ministry, especially the Department of Reproductive Health. And of course, this is to do with the accessibility and of course the affordability of the SRHR services and of course information. So we've actually done a couple of times engaging the department and of course other line ministries like the Ministry of Youth. And proudly, we have also seen the ministry themselves actually training lead facilitators in comprehensive education, like which is actually happening in different districts in the country. So young people have also leveraged the digital and of course media platforms to actually advocate. We've seen a number of radio talk shows young people we have been doing here. We have seen youthful journalists actually advocating, putting the space, creating talk shows in radio programs and also in the social media platforms, talking about the areas of SRHR in as much as access is concerned and of course demanding the uptake of the services. So in Malawi, we've managed as young people in the youth networks that have compiled the case studies on the impact of the cultural barriers on the SRHR services. We've actually seen that a number of challenges have been put forward, especially to do with the tradition, beliefs, and other things. But young people, we have come together and actually fought. We have actually compiled, have come up with the case studies, making sure that we are able to actually wash away the actual mentality that the tradition structures or tradition people like beliefs have on the youth, to do with the cultural initiation, sexual initiations, which have been happening. Currently, the country has actually fought against this, and we are really doing good. And I should also mention the involvement on the development of the COVID-19 youth response guidelines and issues to do with SRHR and GBV among it, of which the youth took also part, and this guide is now in use. And of course, the Minister of Youth had to champion this one with incorporating the young people at large. So we have seen the youth added partnership, well, like sub-granting SRHR and of course COVID-19 programs in as much as this pandemic is concerned. So we have seen a number of organizations, the development partners like VSO. We have seen UNFPA coming in, actually sub-granting youth organizations, like one in our district that I'm coming from. We have seen VSO sub-granting a youth-led organization to surface areas of COVID-19, of course, responding to COVID-19, whilst increasing awareness of the uptake of SRHR and of course other areas. To actually wrap up, we have been having the Meaning Youth engagement in the country, of which we have seen the Minister of Youth actually giving platform to young people. And of course, we have been there, and of course, not only in areas of SRH, but also research, like data correction and other things. Maybe just to wrap up with the challenges, of course, we are talking about stakeholders working in the youth sector should actually be able to collaborate in order to put up systems fostering mutual accountability. So we've seen like this kind has been a little bit of a challenge, but can be actually done. And of course, in areas of coordination, like institutions working in SRHR, we have to actually intentionally coordinate efforts to leverage resources and avoid overlapping maybe and the duplication of efforts to foster efficiency and of course effectiveness. And finally, we are talking about issues to do with capacity building. There's more needs to be done on systematic capacitating young people in different fields, especially resource mobilization, technical knowledge, and of course research and advocacy among them. Thank you so much. Thank you, Primo. Thank you and enjoy.
Thank you very much, Chikondi, for that quite inspiring session, taking us through what you're doing as Malawi. It's quite good to actually see young people stepping up and taking action and taking matters into their own hands and reclaiming power. We are now going to shift focus from young people. We heard from great, young MPs with regards to the Tshwane Declaration, what young people are doing, the UNAIDS report. We're now getting into the meat of this discussion, where we will engage with our honorable parliamentarians. So I encourage most of you to sit back and relax and enjoy this session. And if you have any question for any of the speakers, please do state who you're directing the question to. Also identify yourself by your name and your country, even the organization that you're representing. And then tell us who you're directing the question to, so that we get this session to be very interactive. And also just a little ice break, which we should have done at the beginning for our participants. Please write your name and your country, so that we really know who has joined us, where you're joining us from, and we just really enjoy, the diversity of our audience within this webinar. So in this session, we are going to be getting interventions by speakers of parliament, and we invited two speakers, one from Malawi and the other one from Eswatini. Unfortunately, as my colleague Kurasha mentioned in the beginning, Honorable Petros Mavimbela, Speaker of the House of Assembly of Eswatini, actually gave their apologies, and standing in for them will be Honorable Kendi Zimbili Mpanza, also from Eswatini. So she will be responding in the capacity of the Honorable Speaker of the House of Assembly for Eswatini. I will introduce you to our first Speaker of Parliament, and that is retired Honorable Catherine Gotani Hara, and she is the Speaker of Parliament from Malawi. Honorable Hara is a respected politician with parliamentary experience, plus extensive local, national, and international political exposure and experience. She was the first Malawian to be recruited to the level of program officer for the UK Department for International Development, mostly known as DFID, where she was responsible for the twin sustainable livelihoods programs of Malawi and Mozambique. Honorable Hara has gained extensive experience in diplomatic engagement from her previous roles, which at times required representing the head of state at high-profile international summits organized by or for heads of other states. So just a correction, she's right honorable, not retired honorable. So we have a question for you, Honorable Speaker of Malawi. First, before we ask our question, we would like to take this opportunity to compliment the government of Malawi for the excellent progress made in the areas of outlawing harmful practices in the last years. Malawi is indeed an example of great leadership in the area of harmful practices. We have identified a few issues in the national legislation. They may be the next focus of parliamentarian work. In this regard, there is need for a clear provision related to the age of consent to medical treatment, as the lack of such an age tends to be a barrier to gaining access to adolescent sexual and reproductive health rights services by adolescents and young people, and could potentially jeopardize all the progress made in interrelated work areas of work, for example, child marriage. This is somewhat ameliorated by the progressive policy that provides that the minimum age of consent to HIV testing without parental consent set at 12 years of age. However, it is unclear if this applies to access to other SRH services. Honorable Speaker, would like to hear your thoughts in this regard and your intention to address this legal loophole to ensure alignment of the national legislation to the progressive policy on access to services above and beyond HIV testing services. Over to you, Honorable Speaker Catherine.
Thank you very much, moderator, and good morning to you all. I would like to thank Mr. Tshwane for his presentation and all the other presenters before me for all the presentations you've done on the topic. I'm not going to waste a lot of your time with statistics, but I'll give you a little bit of background in terms of issues of sexual reproductive health challenges and what we have done as a country and what we think still needs to be done. In Malawi, as you have rightly said, as we are talking, issues of sexual reproductive health, we've made progress, but I think there's still a lot of work to be done. As I'm talking, we have now added another problem, which is the COVID-19. On top of the problems we already had, the COVID-19 is proving to be a challenge because a lot of the outreach services have been suspended. A lot of the young people are scared to go to the health facilities because they don't want to go and contract the COVID-19. In the process, they are not able to access reproductive health services. And I'll just give you an example. In one of the districts of the country, it was reported that the number of the youth turning up for SHR services has reduced from 300 to 20 per week. So that is quite worrying. So this, on top of the challenges that we had, COVID-19 has also added more problems. So whilst we're looking at this, we need to be looking at the COVID issue seriously in terms of how it has affected service delivery. Whilst I'm on the same, the issues of budget and the economy. I know we're talking of sexual reproductive health, you're talking of the age, but obviously now that a country like Malawi is facing economic challenges because of COVID, what usually ends up happening is budgeting for these particular services is reduced. And that is also going to have a serious impact on the delivery because now you're trying to divert the little resources that we have to COVID-19. In the process, sexual and reproductive health service, particularly to our young generation, is going to be affected very much. So those are emerging issues that we have to bear at the back of our mind, is that the spending and the budgeting, we will be doing our budgets soon, but I wouldn't be surprised to see that probably these are the areas that get affected because now we have to take that same resource, divert it to COVID. In terms of policy and laws on the provision of access to sexual and reproductive health services for young people in Malawi, during the roundtable discussion that was organized by SADC under the Sexual and Reproductive Health Project and Production Department made a presentation on SHR policy gaps that exist in Malawi. In Malawi, policy laws gaps have been identified on age of consent of SHR services and access of safe abortion service. Age of consent on to SHR service in Malawi, there's no specific age of consent to access SHR. However, Malawi recognizes the following ages of consent to access some services. The amended Penal Code Act 1 of 2011 puts the age of consent to sexual activities at 16 years for both boys and girls. And the Section 13.1 of the HIV and AIDS Prevention and Management Act of 2018 puts age of consent to HIV testing services at 13. So there is no clear age limit for young people to access family planning service in Malawi. Lack of age consent to access SRH service hinders some young people from accessing SRH service. According to the Demographic Health Service that was carried out on the period of 2015-2016, most young people in Malawi start engaging in sexual activities at the age of 15 on average. High risk and sexual behavior is more common among young people aged between 15 and 24. However, according to Youth-Friendly Health Service evaluation study that was carried out in 2014, early sexual debut continues to persist with 20% and 5% girls having had sex by age 10. Self-abortion service in Malawi, 18% of the maternal deaths are attributed to unsafe abortion. Abortion is criminalized under the Penal Code Section 149 and currently is legal only to save the life of pregnant mothers. What has Parliament done to Malawi, what has Parliament of Malawi has been doing to respond to these challenges? To begin with the sexual reproductive health policy laws, the Parliament of Malawi, in collaboration with other stakeholders, is working on the abortion bill to make sure that it is tabled and discussed in Parliament. A task force consisting of members from committees of health, HIV, AIDS, social, and others was formed in order to work on the termination of pregnancy bill. So this is something that is being discussed with the stakeholders and committees of Parliament. During the roundtable discussion in March 2020, Ministry of Health asked the Parliament of Malawi to consider putting the age of consent to access SHR services at age 12. And it also asked us to protect children from child marriages. The Parliament of Malawi amended the provision in the Constitution 2016. The amendment, the age was raised to 18. SHR commodity supply, Parliament of Malawi lobbies for an increase in the SHR budget. If you, for those that have been following our deliberations, quite a number of members of Parliament have been contributing and requesting government to increase, and will continue to lobby for such, because once this budget is reduced, that is going to affect the service. So we're hoping that as Parliament and as members of Parliament will continue to lobby with the executive arm of government to increase funding for commodity supply. And if you even check in terms of our work as Parliament, we are also doing oversight. As Parliament, we've been responding to SHR challenges faced by the youth by conducting oversight visits to appreciate how SHR services are implemented and get information on what Parliament can do to overcome the challenges. For instance, earlier in the month, we had a Deputy Minister who was visiting UNECO to appreciate how they are implementing the services in dealing with child marriages, and to have information on how COVID-19 has impacted on child marriage. Members of Parliament are also actively involved in SHR meetings to discuss some of the challenges that are faced by the youth. And as I have said, as Parliament, we are going to give the enabling environment. Once these bills are brought into Parliament, we will make sure they are given space and tabled in Parliament at the right time. But I think as a country, we also need to go beyond just having policy and laws, because in many cases, we do have some policies, but in terms of implementation and in terms of follow-ups and policing, I think is what sometimes becomes a challenge. We do have quite a number of policies which I'm sure as we're talking, if we go in some of the villages, we still find that some girls are getting married less than 18. So we need to still use what we have to make sure we are policing, to make sure we're actually bringing to book those that are not following the law. It's just not enough to pass the law, but it's actually to implement and follow up and to take to task those that are not following the law. So as Parliament, we'll give them the space. As Parliament, we'll make sure whenever the bills come, we follow them. But it is also my plea that it should go beyond passing the laws, but the actual implementation, I think, is very critical. Thank you very much.
Thank you very much, Honorable Speaker Catherine, for such a comprehensive response. If we have within the audience people who have questions for Honorable Speaker Catherine, please do place them in the chat box. And remember to indicate that the questions are directed to her, and also identify yourself by your name and your country. Moving on to our second speaker, representing the Honorable Speaker of Parliament from the House of Assembly of Eswatini. We have Honorable Candy Zimbili Mpanza joining in from Eswatini. They are a member of Parliament for Shiselweni, second Eswatini, and they hold a master's in human resource for health, and they have worked for the Ministry of Health for 26 years, and they currently hold the regional HIV and AIDS program manager role within the Eswatini AIDS program. It's a pleasure, Honorable Candy Zimbili Mpanza, to introduce you. And here is your question. Firstly, we would like to acknowledge the progress made by the Kingdom of Eswatini in upholding adolescent sexual and reproductive health rights. For example, the Child Welfare and Protection Act of 2012, which has recently come into operation, is an up-to-date law that may serve as an example to other countries in the region. It provides adolescents with comprehensive access to reproductive health services. It allows adolescents to access reproductive healthcare services without parental consent at age of 12, provided he or she is sufficiently mature. However, the newly enacted Sexual Offences and Domestic Violence Act 15 of 2018, assented to the King on 17 July 2018, sets the age of consent to sexual activity to 18 for both boys and girls equally. It is of concern that the Sexual Offences and Domestic Violence Act criminalize consensual sexual activity between adolescents. There's also no clause in age exemption, which places young people at risk of criminalization. Honorable Speaker, we would like to hear your thoughts in this regard and your intention to address this legal loophole to ensure harmonization of the national legislation on the age of consent to consensual sex and the advanced provisions that guarantee to all adolescents access to sexual and reproductive health rights services without parental consent. Over to you, Honorable.
Thank you, Promise. Good morning to all presenters and participants. Am I audible enough? Hello?
Yes, you're very clear. We can clearly hear you. We can also see that you're joining us from a car, which is quite cool.
you know, I'm on my way to work, so I was just checking. I mean, because we have a sitting immediately. But anyway, let me start by appreciating the opportunity to have such a virtual meeting. And I would like to start by saying the country is composed of 79% of our youth population, as it is in the Eswatini State of the Youth Report of 2015 by UNFPA. Issues of reproductive health are in a serious situation, and I think not only in Eswatini but across the world, given the emergency of the COVID-19. People are having challenges in accessing even healthcare facilities because of the lockdown and stuff like that. There's also issues of funds reallocation because the COVID-19 is threatening every economic situation of every country. Maybe coming back to the question, yes, the country has enacted quite some substantial law, which is the sort of Act of 2015, which is also supported by the Child Protection Act number 6 of 2012, as well as the Marriage Act 47 of 1964, which are particularly interested in safeguarding the interest of the youth population. I know, promise, some of these laws may seem to be oppressive when in actual fact they are not. They are intended to protect the youth, because more especially the girl child is so much vulnerable that even every single sexual issue you would expect. I mean, you wouldn't expect, but you'd find that it is always done upon a girl child. So the Sexual Offences and Domestic Violence Act is also talking to sexual relations, which is saying in section 2, defines a child as any person under the age of 18, maybe to start with. So if you're under the age of 18, no one is expected to engage in any sexual activity with you, whether it's by consensual or not, because you still have to be protected. I mean, there's still a lot of things that at that age you are expected to achieve, and it limits your chances of personal progression. When you would fall pregnant, you will even get STIs such as HIV, which is also can be tragic at some point. You get all these other things which might disrupt your future plan as a youth. So the intention of this law is to protect the youth in as far as such matters are concerned. We are also supported by a Child Protection Act, as I have just said, which also speaks to the same, and it also goes on to talk to issues of rape, which in this case, it doesn't matter whether it is a male-female rape, it could be any, but as long as there's no consent within that sexual issue, it remains a rape as well, which can be, which is a criminal offense where you can be imprisoned of a period not exceeding 20 years. I mean, the intention even then is to protect the youth population. We also have in the country the Marriage Act number 47 of 1964, which also, I mean, these are just supporting documents which are actually stressing the point that, yes, the youth population has to be taken care of. We need to try as much as we can to put away all efforts that can actually harm the lives of the youth population. We are facing a situation as a country as well, as I have said earlier on. The COVID-19 is putting everyone away from their routine activities, and the youth is no exception to that. They have to stay at home, and they started staying at home somewhere in March, and that is creating so much challenges within them, because I mean they have peers to meet and share ideas, but I mean there's so much frustration and stuff which might as well expose them to other issues, because like I said, the issue of accessing healthcare facilities is now thwarted by the fear, because there's this panic mode that was affected by the issue of COVID-19. So there's just this kind of thing. I'm seeing a lot of young people going through that kind of stress and anxiety, and this might end up exposing them even in very serious issues, which I think the law will obviously come in to support them and protect them from being abused by those who may appear to be assisting them, because this is a very critical time, Program Director, which is exposing the youth population. I was talking to some girls the other day, just trying to find out what their feeling is when they are sitting at home. You see, they are even complaining that they when they were going to school, they were even accessing those pocket money. They could be able to buy themselves those small things, which is not the case now. And again, that is an issue which might expose them to a lot of people, and bless us, and we might see issues of intergenerational sex and stuff like that. And I think, yes, our laws will come in handy in protecting those youth in as far as the SRH and COVID-19 issues are concerned. Yeah, maybe that's all I can say. That yes, indeed, we do have those legislative issues which are there, and they are doing what they're supposed to be doing. We're getting people incarcerated that go against the law, and the people start complaining because, you know, like the SOTV Act, which is still very new, it's very hard on offenders, very, very hard on offenders, such that some, even if they had powers, I mean, to trim it, people could trim it, but I mean, not because it is disregarding certain humanitarian aspects, but I mean, it is working against those things which people have even taken as norms. So I think with those words, on behalf of my speaker, there's quite a lot that we are doing as a country to protect the youth population. And I want to urge them, as I conclude, urge the youth population. Some of the things that the countries are doing may sound not sensitive to certain issues, when in actual fact they are sensitive issues. I know some of the things the youth would want to move freely and do things freely, but the consequences are more than them moving freely to wherever they want to go. For instance, if you go out and you get raped, the consequences are irreversible, even if the person can be taken for that matter. But the fact that you've been raped, it does not really go away so easily from you. It has a stigma of some sort, and an indelible stigma. So I want to urge them to get to understand some of the way in which parliaments and governments and countries work. Whatever they are doing is to their interest. Thank you.
Thank you, Honorable Kendi Zimbili Mpanza, for your strong dedication, which we surely see and witness. You are even joining us from a moving car, which is very impressive. We are very happy to have you here, and we are aware that you have to leave immediately. I hope you will be able to take one or two questions and comments that came in through our chat box, if that's fine. And then we'll come back to you, Honorable Speaker Catherine. So just very quickly, so we got a comment here, initially acknowledging the progress you have made with regards to creating legislation in Eswatini that allows for, access to sexual and reproductive health rights for young people. At the same time, attempting to strike a balance between protection of minors as well. There's a question on how you're bridging the gap between what ideally it should be and the evidence that shows that young people are actually engaging in consensual sex. Facts prove that the median age of sex in Africa is between 16 and 17. Can Eswatini consider adding the clause in age defense to avoid criminalization of minors close in age? This will still give them the right to access and services. So that is the first question. I see there's a second question here, and it's coming from Vapelele from Eswatini. And he said his question is directed to Honorable Mpanza. What is the government of Eswatini doing to ensure that SRH services are available to the youth of Eswatini? So those are the two direct questions that we will ask, and I'll give the floor to you to respond.
Thank you, moderator. Thank you to those that have posted those questions. Well, adding the like you were saying, the 16 to 17 age has been seen to be the age where the youth start engaging in sexual activities. I think as I am taking these questions, I will also lobby my colleagues that maybe we look at this issue, because I think we all know Parliament is not a one-man show. Whatever you are doing, legislative matters, you have to lobby, and it must be understood by your colleagues so that you can make those amendments where need be. So I'm taking this one with me. The questions that were posed, then I will start lobbying, because like I said, when you read my bio, I worked for the Ministry of Health, and I dealt with quite a number of different people. So and how far we can go. The issue of SRHR, I don't know, but I think when we talk of SRHR, we are talking about accessibility to the services. And in the Kingdom of Eswatini, we have not had a challenge with that. All our health facilities have what we call friendly corners. The health facilities administrators or nursing sisters or nurse managers to such matters. Well, I don't know, unless I have a limitation in understanding the situation out there. But I think, like I'm saying, where the youth would come and ask if they have to ask whatever they are asking, whether it's services or questions, concerns, myths and misconceptions, they would just go there. And as a country, we sometimes, because we are functioning as a country under what we call constituencies, as you have rightly read it, that I'm representing Shiselweni 2 constituency. We normally converge to community meetings where people would come in and girls we separate and boys on their separate group, the middle-aged, the adult age, and all different groups, and we bring them together to share their views. So this is not that much of an issue in our country. Yes, as even the Constitution speaks to issues of SRHR, people do access those services. We with the support of different partners, even UNFPA is supporting that program. In as far as I know, Primrose, we don't have much of a problem, except that maybe there are issues. I mean, because when you talk of stigma, you're talking about something else. Some people, you find that they know those people within that particular facility, and they don't feel like going there maybe for whatever service they may look for. Then they'll decide to opt for whatever they feel is appropriate for them. But otherwise, as a country, I think that's one other. Thank you.
Thank you very much, Honorable Panza, for your time, your dedication. And just to let you know that indeed, we are also very happy to support your lobbying through SADC PF. Please call us in as partners and arms in the struggle, and we can collectively work together to support your lobbying. I just received a chat from Senator Dlamini, who's also from Eswatini. You see the beauty of having like young parliamentarians and their seniors in the same space. He's from Eswatini and he wants to compliment your response. So I will open your mic, Senator Dlamini, and give you the floor to add on to responding to that question. And Honorable, you are now free to drop off at any time considering your other commitments. But thank you very much for joining us. Over to you, Senator Dlamini. Okay, so your mic is on mute. We can see you talking.
Okay.
Thank you. We can hear you now.
I'm muted. Okay.
We can hear you now.
It's not too much to add. He did cover quite a lot. Just on the first question that you posed, which was the age of accessing services being 12, and yet age of consent being 18. So that wasn't a mistake. The age of accessing the services being 12 was done so that if a child is by any means violated, they are able to access those services, but then it's a crime for the person through the results that will come out from that child being tested. The hospital has the responsibility to then find out why a child that isn't 18 has these problems, sexually related problems. So the age of consent being 18 is because the thinking was most children lower than 18 are still under the care of their parents. So if they do engage in sexual practices, actually the parents aren't happy about that. And so in the SODV, it was trying to correct the views of parents, because there was quite a lot of consultation during the process. And the parents were the ones that wanted the age to be moved to 18. So that's the addition I would like to add to what Honorable Stridham said.
Thank you, Senator. We then got another question to your response. So it's quite brief. And the question is saying, what if the sex was consensual?
Between
the minors, yes.
Young children, between two minors?
Yes.
Well, I guess the courts would have to decide, but I believe that nothing would happen to both of them. I believe that. However, it would have to be tested in court, because the law just said the age of consent is 18, and that's where it ended. And the judges would then have to decide what they do if it's two minors that have engaged in inconsensual illegal sex, because it's consensual, but it's still, according to the law, illegal. But it would be for the judges. I think they'll probably just smack them on the bum or something, like, I don't know.
Okay, thank you very much, Senator, for that response. I think we also got a couple of questions coming in for the Honorable Speaker from Malawi. Maybe before we get to those, there's just one question for UNAIDS, actually. This is in response to the presentation that was made earlier, that was sharing the key findings to the research that was done by UNAIDS. So I'm going to direct this question to Dr. Christian. I will give you the flow. There's a participant called Mulenga from Restless Development Zambia, who said they just need a little understanding on what you mean by the people's vaccine. So over to you, Dr. Christian, if you could check the flow and respond to the question. Okay, so you are on mute. If you could.
Hello, can you hear me now?
Yes, we can hear you. Thank you very much.
Okay, I'm Christian Mola, UNAIDS Senior Advisor in ESA region. Thank you for the question. On people vaccine, it is the world leader unit in call for a people vaccine against COVID. It's a solidarity unit initiative, which was launched since the 14th of May. We including more than 114 leaders of the world, including President Cyril Ramaphosa, which is the chair of Africa Union. The aim of this initiative is that to advocate for and to have a most ambitious position at a global level to have a COVID vaccine, demand that all vaccine treatment tests to be free to every people. It's initiative of solidarity to guarantee that COVID-19 vaccine treatment tests are provided free of charge to everyone, everywhere. And on this, you can have the more information on the link, which will be shared to all participants. Over to you. Thank you.
Thank you very much, Dr. Christian. So the next questions I'm going to ask are actually directed to Right Honorable Catherine Hara, Speaker of Parliament for Malawi. So I will read out a couple of questions for you and then give you an opportunity to respond to them. And then I encourage the audience to also do share in any questions you may have for the Honorable Speaker from Malawi. So there is Nyatuwe Piri. Thank you for joining us. And he or she says that they were particularly interested to know how you balance receiving pressure from people who have already started thinking there will be a bigger struggle in tabling the termination of pregnancy bill now that there is a new government. So that is a first question for you. And then the second question for you is coming in from, actually, the other one is for the Kingdom of Eswatini, actually. And then it's maybe you could speak from a Malawian perspective, actually, in terms of during the pandemic and lockdown, how far the Malawian government has gone to ensure that services are delivered for young people. And then I strongly urge our audience to share in additional questions that you may have for Honorable Catherine. But over to you to respond to those two questions, one on the termination of pregnancy bill, and the second on efforts by the Malawian government to build back better from COVID-19. Over to you.
Thank you, moderator, and thank you for the question. Indeed, in terms of presentation and process of bills, I'm sure you do know that as Parliament, we have a process. We will wait for bills either coming from private members in the House or from government. So government is responsible for bringing bills to Parliament. And as Parliament, we have now to give in the enabling space for the bills to be tabled in Parliament. Once those bills are tabled in Parliament, it now goes back to the individual members of Parliament to actually vote on that particular bill in their role as representatives of the people. So in this case, I cannot speak on behalf of the executive to say whether the bills are going to come or not, because that is not my jurisdiction. My jurisdiction starts when the bills are actually have gone through the process they've gone through cabinet, from cabinet decides to present them to us. My role at that point is to make sure I give them the agency they need. I make sure I give them the time that they need in Parliament, and I make sure I present them to the business committee for us to approve for them to be on the agenda. So in real sense, it's a process. It just doesn't start from Parliament. Parliament can't just, as a speaker, I can't come up and say, I'm bringing in these bills. According to our constitution, bills can only be brought by the executive arm of government and through private members' motions. No, now it is for the people to either lobby with private members for any bills that they want, or in this case, if you want, you lobby through government to say these are the bills in terms of priority, and then they are presented to us. Our role is to make sure we give the space so that those bills are discussed and tabled. And from then, it's now the roles of the individual members of Parliament to either support the bills as presented, or they do amendments, or indeed to reject them. So the rest also moves out of my hands as a speaker. It goes to the honorable members in their role according to the constitution of representation. And on the issues of lockdown, I'm glad to say that I think Mr. Chikondi Gia mentioned it, that we now have a youth caucus, which we never had before. We've not yet 100% finalized, but we're almost there. And this is another avenue that I think is going to help us to lobby. Once the budget is presented to Parliament, we expect the youth in Parliament, the youthful members of Parliament, to actually lobby to ensure that there is enough resources allocated for delivery of services for the sexual and reproductive health, as well as other committees like the health committee itself demanding to get more funding. As you know, schools have also closed, and reports have it that a lot of young girls are getting pregnant because they have so much idle time, they have nothing to do. So it means it should be everybody, every member of Parliament's concern to make sure they lobby for more funding in order for us to guarantee services, sexual and reproductive services, health services for the youth. Because if we don't, then we're breeding more problems for our future. So for us, as much as I'm a speaker, I'm also a member of Parliament. I privately will also lobby with the concerned, for example, Minister of Health, to say this is an area that they seriously need to look at, looking at the COVID issues, what it's bringing, and what measures we need to do to make sure we protect our young generation. Thank you.
Thank you, Honorable Speaker Catherine. It seems like because Honorable Mpanza has left, you are meeting the firing squad on your own, and we're getting more questions, which is actually a good thing, because that's the whole point of this discussion and engagement. So I have two questions. One is coming from Chikondi, who's from Malawi, and they're saying, how exactly does the Youth Caucus work? And then I'll give you the second question and then allow you to respond to both questions. And then the second question is a call from young people, actually. They're asking, what can young people do to support you in the lobby process? And also what, especially in terms of the young people in the panel and beyond, young people in Malawi, what can they do to support you in the lobby process? Over to you to respond.
Thank you very much. In terms of the work of the Youth Caucus, as I've said, it's something that we just in the final stages. As you know, years before, in most of the parliaments, especially in the SADC region, we've had what we call Women Caucus. What that caucus has been doing is to advocate on issues to do with women, specifically issues to do with generally what affects women in Malawi and in all the other countries. Now, because of the work that is being done by the Women Caucus and the importance that it has shown that we do need the Women Caucus because they do focus specifically on issues to do with women, it was felt that the youth also need to have this type of representation. As we're talking, it's not a constitutionally established caucus for the youth, but we want to add it on as a caucus, just as the women caucus. So this is a committee that is going to be specifically looking at issues that affect the youth. Now, this would be a very good tool for the youth to use if they have any issues that they want presented in Parliament. They can use the youth caucus. They can contact the members of Parliament who are the young parliamentarians to say, we have these very specific issues that affect us as youth, and we want you as young members of Parliament to present these for us on our behalf in Parliament. If you can't use the caucus, you can also use a form of petitions. You can petition the speaker to say, we have these issues which we feel as the young generation of Malawi, we want Parliament to discuss. So you can actually petition the speaker, and these petitions are read in Parliament, and you can demand that we want this particular issue, maybe sexual reproductive, issues of unemployment for the youth. So there's so many topics that can be tackled through petitions, but also through the caucus. The caucus will be able to take it up as a committee of Parliament. It will make presentations in Parliament to the fellow members of Parliament on the plight of the youth. But the youth also can use what we call petitions to the speaker. They can come, make that petition, get a member of Parliament to present that petition in Parliament. So those are some of the tools that can be used. But also the general lobbying. Nowadays, we're using a lot of social media. Let the youth air out their views on what they think Parliament should be doing through social media. Let them use the public media. Let them use all the media platforms to say, we think as Parliament, this is what we want. In that way, you get our attention quickly. You get the attention of the executive, because some of the issues, yes, as Parliament, we can take it up, but we also need the executive arm of government. So they should do the lobbying, to the Minister of Youth. Let them lobby with me as a speaker by sending the petition, even identifying a member of Parliament here. And for the first time, we have the most youthful Parliament in Malawi. So we have got a number of MPs who are young. So take an advantage of that. Get any of the young parliamentarians who are in the chamber. Ask them to say, you are in there as a youthful member of Parliament. We want you to champion our cause. So that can be done through a private member of Parliament, through a caucus, or even indeed petition the speaker myself.
Thank you, Honorable. I think you gave us very comprehensive responses. As a woman, I'm really inspired to even want to join politics. Maybe I'll be as eloquent as you. Thank you for all your responses, for your intervention, and for the work that you're doing in Malawi. I think we have a question that is coming from a young person that is directed at Chikondi, the Malawian chapter president for AFRIAN. While the question is not very clear, and Chikondi even called for clarity, but I think Simpungwe from Malawi wants to know how they can get involved with AFRIAN Malawi, and they also want to know how you engage with young people, especially the district-based young people in Zambia. How can they be part of your intervention, and how can they contribute to supporting your efforts? Over to you, Chikondi.
Oh, please, Primo, thank you so much for the clarity, because I was supposed to ask some question. And also I should make it clear that the question which was asking about how does the caucus work, it wasn't me who asked it, it was the same Simpungwe. So it was directed to the Honorable like Speaker, Madam Hala. Sure. So the question to do with how do we engage young people and how best Zambia can do this, it should be known that firstly, young people have to be so innovative, because we have actually seen for the most of times that young people have applied for space, especially meaning youth engagement. The first thing that we should indeed show out that we have that capacity, that we can actually call upon the decision makers. We can hold them to account, we can bring them together so that they can actually hear, they can listen to us, and then try to trust us. Our actions first should be the ones that can be trusted. So what we have been doing in Malawi, we have always proven ourselves that we have the capacity. So we have actually engaged at district level, we have engaged at national level, and at district level, it starts with the district youth office, say for example, and then all the technical working groups, and of course, the director of the administration, and also maybe we're talking about the director of development and program development, the DPDs. So it's all about yourself as young people getting organized. Once we have been organized, you need to actually cite what you want to have. So I think the question was, how are we engaging the districts? So we are trying to engage the districts, firstly by organizing ourselves, and then seeking the guidance from technocrats, say for example, the ones that are presenting young people in the district councils. And then those people, if they actually buy what we are trying to say, they will come in and support us technically and see how best we can go to the communities and engage young people, so that young people should be able to voice. So we're using the available structures that we have in the districts. In the district, you have got the community development structures, we have got the area development structures. These ones are the ones that we're using so that we can engage young people. So the youth themselves, they are actually the ones ourselves, we are the ones who are showing up. We are showing up so that we should be able to cite what we want, the demands that we have. So in as much as SRHR is concerned, firstly, it should be known that Malawi is also one of the countries which is rich in traditional beliefs, of which some of them have been the hindrances. So it hasn't been easy for us, but we have managed that we have engaged these young people. I think if the question was to do with how we're engaging the districts, if I'm clear, if I've gotten the question clearly, then that's how I can answer. But if I haven't gotten the question clearly, you can always come back again, and then I can be able to come up.
Okay, thank you, Chikondi.
Yes.
For your response. I just want to reach out to our honorable, MPs and speaker to find out if you have any last words you want to be saying. We can start with you, Senator Dlamini. If you've got any very top line, very briefly, if you have any last few words you would want to say to close this segment of the program. The microphone is on mute. Okay, so Senator Dlamini, your microphone is on mute. Perhaps as Senator Dlamini tries to fix his microphone, we can come to you, Honorable Catherine. Oh, I see it's now on. Please
yes,
go ahead.
Yes. I'd just like to applaud the SADC Parliamentary Forum for making this session a possibility. Issues of the youth have been a huge topic for many years in the forum, but I can see that they really gaining momentum. And as an ex-member of the forum, I'm very excited to see the forum doing this and involving the youth as well in these sessions. So those would be my parting comments. And thank you to everyone that contributed.
Okay, thank you, Senator Dlamini. And Honorable Speaker Catherine, any last words?
First and foremost, let me thank the organizers and SADC for
Oh, we seem to have lost Honorable Speaker Catherine. If someone could text her in the chat box that we have lost her, because we seem not to be getting any feedback from her. But anyway, Honorable Speaker, Honorable Senator, colleagues, and all our participants, as you know, all good things come to an end. And to close off this session for us with closing remarks, I will introduce, Miss Doreen Kampaire from Afrian Uganda. Miss Doreen Kampaire is a sexual and reproductive health and rights advocate and family planning youth champion at Afrian Uganda chapter. She's a population scientist and by profession, and currently a communications officer at ACODEV, an NGO in Uganda championing transforming communities across rural and urban Uganda. She has vast experience in digital communication and using social media in the field of reproductive health. Over to you, Ms. Doreen.
Thank you so much for this great opportunity. As you introduced me, my name is Doreen Kampaire. I'm from Uganda. I am a family planning youth champion at Afrian Uganda. Well, thank you very much, honorable members, for the great discussion. It's really interesting to see how issues of the youth have actually advanced to reach the parliaments, to reach platforms whereby they can be listened to and they can be put into policy. However, we have issues whereby they are tabled in parliament, but the youth down there are not empowered. They're not given the platforms to go ahead and actually do something on their own. During this time of COVID-19, the youths were helping each other across even East Africa, where I am. The young people living with HIV were delivering the medicines to their fellows. And in a way, the parliamentarians up there were not really participating. So one thing I would really want us to take from this discussion is that we can use the peer-to-peer approach to reach out to our fellow young people, as young people, and we can also work on empowering them, especially those in rural areas, those ones in urban areas, and use the platforms we can easily access, such as social media. I've used social media for the last 2 years to communicate sexual reproductive health, and it has really helped me to reach out to my fellow young people. I have people sending me inboxes about issues they're facing, and helping them is really a milestone. As Afrian Uganda chapter, we've carried out scientific community dialogues where we involve local leaders in different parts of the country. And these dialogues have been broadcasted on local media stations in local languages. And this has actually helped to reach out to the young people down there in the communities, because from the TV or radio, it's able, that message is taken to the young person in the village. I also want to inform all the panelists and participants that there will be a next engagement on 12th August, which is the Youth Day. And the theme of this Youth Day focuses on the importance of young people and their engagement in political institutions and multi-sectoral organizations. So you're all invited for that engagement, and we hope to see you there. Conclusively, I would say that all our political leaders, everyone in their capacity, the civil society organizations, please support a young person, because when you support me as Doreen, you're able to support maybe my brothers and sisters and everyone. And if it starts from the beginning, from down here, we already have the evidence that that evidence we gather from supporting the young people will help us to also influence policy with that evidence that is already shown. Yeah, thank you very much for this opportunity, and yeah, I hope to hear from you very soon. Thank you.
Thank you, Doreen. With those last words, it brings us to the end of our Regional Youth Endowment. Thank you very much for joining in. Bye.
Thank you.
Thank you. Bye.
Bye-bye.
Bye. Thank you so much.
Bye.
Thank you. Bye-bye.
Thank you,
Bye.
Primo.